Hello, I'd like to share some information with you today in regards to insomnia. This information is coming from verywellmind.com, written by Sarah Van Verskik, and medically reviewed by Armin Poor. So, what is insomnia? Insomnia is a common sleep disorder that affects many people. So, what we want to kind of speak to is that research indicates that people seeking primary care treatment and the prevalence of insomnia is pretty high. It's 69%. Lack of sleep tiredness is known to contribute to many serious health concerns, such as high blood pressure, diabetes, possible depression, anxiety, stress, stroke, etc., etc. Effects of chronic sleep loss are accumulative. So insomnia also takes a significant toll on cognitive abilities, emotional self-regulation, executive functioning, mood, working memory, the ability to focus and pay attention, making decisions. Research also shows that chronic sleep loss can promote negative emotional processing. So there are some signs and symptoms of insomnia. The lived experience of having insomnia tends to vary widely among those who have those experiences or symptoms, and they may change over time in tandem with the person's life and any other physical and or mental health conditions that may coexist with sleep concerns or issues. So what we would like to do is kind of rule out, kind of explore the signs, symptoms, causes of insomnia that you're experiencing from those related to health issues. Can be challenging at times because many of them may overlap or exacerbate each other. So generally, an individual with insomnia may have these signs and symptoms, which are feeling that they're not getting enough sleep, difficulty focusing throughout the day, only being able to stay asleep for short periods, daytime drowsiness, feelings of frustration and or anxiety by a perceived difficulty or the inability to fall or stay asleep, kind of not having a non-restorative sleep, poor executive functioning, not feeling rested upon awakening, waking up too early, trying to fall asleep, sometimes for hours without success. So it's important to note that insomnia can impair one's ability to operate safe machinery, the ability to drive, things of that nature. So to be diagnosed with insomnia, as mental health providers, experts, you will need to kind of have an assessment and evaluation done, and it may be beneficial to be diagnosed or to have a diagnostic assessment in regards to sleep. A person that experiences insomnia is subjective and self-reported, and it relies on your likely groggy recollection, fractured sleep, things of that nature. So self-reported criteria, it's important to note that lack of sleep due to work schedule, staying up late studying, other reasons may not have enough time, or maybe the reason to not have enough time to sleep, and may not constitute as insomnia. Insomnia means not getting enough sleep despite having the time and the attention to do so. So there are functional impacts to that. So A key component of the diagnosis of insomnia is how a person's problems with sleep impact their daily life, like functioning. Functional impairment related to insomnia may include inability to work, staying focused on daily tasks, irritable experiences of anxiety, poor work performance, etc., etc. It also can be often undiagnosed. So sometimes adjusting um, to treatment to a coexisting condition can drastically improve your sleeping habits. Your doctor, your mental health provider does need to know that you're having concerns, issues, trouble sleeping in order to suggest some changes and support. So this is why talking to your doctor as well as a mental health provider and getting diagnosed with insomnia can be of importance. So the causes. So the causes of insomnia can be of many and somewhat exclusive and elusive and hard to precisely distinct as a condition that involves a complex interplay of mind, body connection, medical history, environmental factors, and outside influences. So here are some common causes that contribute or that are contributing factors that are not all inclusive. These are just some causes. So there are emotional concerns such as grief, anger, loneliness, worry, chronic pain, which can settle down at night uncomfortably. Other sleep conditions such as sleep apnea, dementia, other mental health conditions, excess of electronic devices, irregular sleeping habits, medications, let's see, like poor sleep habits, stress again, and in general, and also in response to a specific life event. Neurological disorders, use of alcohol, caffeine, and or nicotine. So insomnia is a good example of the chicken and the egg principle, right? Which really means which came first may not really be what matters, if you will. Either way, the negative effects and self-affirming cycles that an individual is experiencing, through the vicious kind of cycle of lack of sleep and the insomnia, those kind of roller coaster, ups and downs, ebbs and flows. That's what's kind of important. And identifying and then eliciting coping skills and tools to support yourself in receiving the treatment that may be helpful for you in gaining the sleep that you're seeking. So there are some risk factors, right? So they can possibly contribute to kind of dodging the sleep condition. So there are some most common risk factors. Some of those can be comorbid conditions, age, life history, frequent travel with different time zones, frequent environmental disturbances, use of electronics at bedtime, lack of regular exercise, shift or night work scheduling, use of stimulating drugs such as coffee, alcohol, prescription medications, again, check in with your prescriber, your doctor in regards to that, and or illegal drugs. So we also kind of want to talk about the types of insomnia, right? So insomnia is not the same as having time to get enough sleep due to your schedule. Insomnia means having the time and the intent for the sleep that does not come. So there are some multiple subtypes of insomnia that we want to kind of like speak to that are specific of an individual's sleep condition, age, coexisting medical conditions, and other factors. So there's acute insomnia, which is called adjusted or short-term insomnia. It is short-term, lasting anywhere from one night, or two to a few weeks and a month. So short-term insomnia may come and go as people deal with ups and downs in life. Usually this type of insomnia will resolve when the stressor that is triggering is then relieved and the person has adjusted to that particular stressor. There's chronic insomnia, which is more long-term. A chronic insomnia is defined as having trouble falling and or staying asleep for 3 or more nights per week or 3 months or more. Right? There are other types of insomnia, which some are common subtypes, including behavioral insomnia, which can be prevalent in children. There also want to kind of focus on another type of insomnia is persistently waking up with kind of nightmares and night terrors. There's treatment though. Finding the best treatment for yourself for insomnia can be complicated with many factors. However, as noted above, what I've mentioned, many people with that are experiencing insomnia, if it's untreated, can continue and often have coexisting medical conditions. Effective management is especially challenging at times as it's not just one factor. Treatment may involve a bit of kind of trial and error, as the individual will likely take some time to resolve all of those various items or physical stressors, mental health issues at play, and reestablish healthy sleep habits, instilling healthy stress reduction techniques, resyncing their sleep rhythms, and replacing worrisome, fitful sleep with restorative kinds. Your doctor, your mental health provider can work collaboratively with you to kind of tailor the treatment plan to your specific need. You also want to address underlying conditions and concerns. So, some underlying conditions and concerns may include mental and physical health concerns, as well as emotional concerns, problems, and or the fallout of stressful or traumatic life events. It may be beneficial to kind of start instilling some calming techniques such as acupuncture, aromatherapy, listening to music, massage, gentle physical activity such as yoga, walking, stretching if you're medically able to, mindfulness, reading, taking a warm bath and or shower, and also implementing consistent bedtimes. So even if you're having trouble falling asleep, following the same schedule cues you that it's time to sleep and helps you sync your body with the natural rhythm. It's important to avoid daytime napping, as naps can interfere with nighttime sleep. So you want a healthy sleeping space. If it's possible, keep the TV, computer, work desk, phones kind of like out of your room, or at least out of arm's length. So ideally your bedroom is just for sleeping, so that when you enter the room, your mind and body associates that with rest rather than work, entertainment, socialization. So you may want to establish a set routine. The key to do this is the same sequence of relaxing activities before bed consistently. The pattern can help you set the stage for easier time falling and staying asleep. Also monitoring your meals and drinks kind of limiting caffeine, alcohol, smoking. If you're waking up to go to the bathroom, if that's an issue for you, aim to limit drinking beverages before bedtime. Also, reviewing your medications, and do that with a medical prescriber so that they can assist and support you through that. Also, cognitive behavioral therapy may be of assistance. This type of therapeutic services is done specifically to treat insomnia. It usually entails a short term, 6 to 8 weeks, if you will, teaching the individual about healthier sleeping habits, skills that are involved in falling asleep and staying asleep. So CBT, though, is done under the supervision of a doctor, nurse, therapist, and seeks to change the individual sleeping patterns, related behaviors, and thoughts. Excuse me. There's also pharmaceutical treatments that can be of assistance, but again, check in with your medical provider to assist you with that. So coping, right? Learning to comfort yourself and relax when you begin to feel worry about not being able to fall asleep or not getting enough sleep can be challenging. Also, it's the key of overcoming insomnia. So, excuse me. You want to kind of identify what hours may work best for you to get that 6 to 8 hour sleeping time. Trying multiple approaches. There's not just one way to skin the cat. Stay flexible and keep on the outlook for when to make adjustments to your routine if you notice your sleep issues kind of creeping up again. Seek help if needed. If you're experiencing something particularly challenging that is impacting your sleep and general well-being, seek help from your doctor and or therapist. We are always kind of having more ways to address your insomnia and kind of supporting and assisting you to get the rest that you need. Be kind and patient with yourself. I'm going to say that again. Be kind and patient with yourself. Insomnia is not a right or wrong. Remember that some life events, such as like job loss, death, traumatic events, divorce, separation, things of that nature, are inherently stressful and challenging to sleep through, regardless of your adherence to optimal sleep practices. So what's the takeaway? While there may not be a magical one-size-fits-all cure, if you will, for insomnia, there are effective ways to treat the pervasive sleep concern. It's not too late to seek assistance and or help. The key is finding the right approaches for you that will work and stick with the needed changes and treatments long enough for newer, healthier patterns to experience those longer periods of sleep. So I hope this information was of assistance for you today, and enjoy the remainder of your day.